I'm Douglas Massey, and in this brief video, we're going to break down in simple layman's terms the difference between Medicare Advantage plans and Medicare Supplement plans. So whether you're an insurance agent or maybe a Medicare beneficiary who's trying to figure things out and navigate through this confusing world of Medicare, this video is specifically for you. And yes, now is the perfect time to give this video a thumbs up and subscribe. We're putting out new insurance-related content every single week. One of the most common questions that we senior insurance agents get is, what is the difference between Medicare Supplement plans and Medicare Advantage prescription drug plans? And guys, I totally get it if you are feeling a little overwhelmed by some of the information, especially around October, November, and December, you know, when you start seeing all the TV commercials telling you to call now for more Medicare benefits that you're not getting. And guys, before we get started, FYI, beware. When you call these 800 numbers, you know, from the TV commercials, the people working in those call centers will often tend to, how do I say this? They'll put selling insurance ahead of the needs of you, who may be the client. And the next thing you know, you got yourself a Medicare Advantage plan that maybe like your doctor doesn't take or that doesn't cover your prescription drugs in the way that you are used to. Not good. Traditional Medicare has two parts. Now, Part A, which is mainly your hospital insurance, and for those recipients who've worked and paid taxes in the United States for at least 10 years or 40 quarters, should be getting this for free. And then there's Part B, which does have a monthly payment that is taken directly out of the Social Security check to cover. In 2022, this monthly payment is going to be going from $148.50 to $170.10, and unfortunately will increase over time right along with inflation. As an insurance agent, I've met with folks that thought they had Part B for free, and you know what happens is a lot of us, after a while, we tend to not even realize that the monthly premium is automatically taken out of the Social Security benefits. FYI, only Medicaid recipients have no payment for Part B, but that's a different subject for a different video altogether. Now that the Medicare beneficiary has Parts A and Part B, there are other insurance options which the needs of the clients all tends to vary based on, one, where you live, because networks are totally different from each county and each state, and B, whether you can afford to have a Medicare Supplement plan or are just better off going with a regular Medicare Advantage plan, which in some cases, guys, will pay for some or most of that Part B premium and won't have any additional costs at all. Again, this all depends on where you live and the available doctor networks for the plans in that area. Either way, guys, whether you've got a Medicare Advantage prescription drug plan known as MAPD or a Medicare Supplement plan known as Medigap, the doctors and hospitals send the bills to the insurance company to take care of. Traditional Medicare Parts A and B do not cover your prescription medications and tend to have a lot of copays and other out-of-pocket expenses. Therefore, this is where you may consider looking at an outside insurance company, an outside insurance product, either getting the MAPD, Medicare Advantage plan, or a Medigap, Medicare Supplement plan. Again, all states and counties vary and are a little bit different. Most people in my state, Florida, and like a lot of the larger states like Texas and California, for instance, will definitely be better off getting like a Medicare Advantage plan. So we're going to come back to that later. Let's talk about a Medicare Supplement first. Since your original Medicare does not cover your prescriptions, you will need to purchase a Part D drug plan from an insurance company, which, yes, this means a monthly premium. And you're going to need to purchase your Medicare Supplement plan from an insurance company, which also has a monthly premium at it too. So your Part D plan covers all your prescriptions, while the MedSup or Medigap plan will cover all the other out-of-pocket costs that maybe parts A and B aren't going to cover, like the deductibles, co-insurance, and other out-of-pocket costs. Interesting enough, Medicare Supplement plans are all standardized. They're all exactly the same, no matter what insurance company you get them from. For example, if you have a Medicare Supplement Part G, it will be exactly the same from every insurance carrier offering a Part G Medicare Supplement. Some of the benefits of having a Medicare Supplement are that there are no doctor networks. Therefore, you can go to any Medicare provider in the United States, which gives you some peace of mind, in the event where maybe, I would say, you have a health issue while you're on vacation and are traveling. These plans also have very comprehensive coverage, so you don't have to worry about paying thousands and thousands of dollars in the event where there may be some kind of medical emergency. And also, there are little to no copays. So this sounds pretty darn good, right? Yes, but what are the downsides? First off, you can actually be turned down from a Medigap plan based on your health because these plans are medically underwritten. Okay, so let's say you apply for a Medicare supplement and you've got congestive heart failure, for example. Some companies will decline you outright. No thanks, we don't take that. Another downside is that you still have to make that monthly payment for Part B on top of all the other monthly payments. The monthly payment for both the prescription drug plan and the MedSup, which will most likely be at least a few $100s per month. Dental, vision, and hearing are not covered either, which leads us to the Medicare Advantage MAPD option. Medicare Advantage also covers what original Medicare Parts A and B cover, and some plans can cover a lot more. Insurance companies, what they actually do is they bundle Parts A and B with additional outside insurance benefits like dental, insurance, vision, hearing, and sometimes other stuff, which can include money allowed for like healthy foods, over-the-counter items that you might normally get at your drugstore, and even like rides to the doctor's office. In most cases, you still have to make that monthly payment for your Part B, but some plans will actually have what's called a give back that pays you some or even most of that Part B money, that monthly payment back in exchange for other benefits. A big difference between Medicare Advantage and Medicare Supplements is that, again, the MedSups are all the same. They're, standardized, which is completely the opposite of Medicare Advantage. Some insurance companies offer multiple Medicare Advantage plans with completely different bundled options. In other words, some Medicare Advantage plans don't cover medication, but like they might give you dental and even give you money back to cover part of that Part B premium, while other plans like maybe will cover the medication and have a gym membership included. In some of the areas, there are and this is crazy, 40 or even more than 50 completely different Medicare Advantage plans. Some plans are HMOs and others are PPOs, which with the HMO plans, you have to go to your primary doctor for a referral in order to go to a specialist, while a PPO plan usually gives you the flexibility to go directly to your specialist without a referral. And in most cases, they tend to have more doctor network options. And yeah, I know all that sounds pretty darn cool, but what about the cons of the Medicare Advantage plans? Well, so with Medicare Advantage, you usually don't have that network freedom that you would have with like a MedSup. And if you do need to go visit a doctor out of network, like, if you have a health issue while traveling, you could end up paying and having a much higher out-of-pocket cost. Thankfully, most Medicare Advantage plans do have a different out-of-pocket maximum that will put a cap on that out-of-pocket spending. Another con is that the MAPDs have higher maximum out-of-pocket maximums than the Medigap plans. So As of 2022, the maximum out-of-pocket, or MOOP, we call it the MOOP, for medical services is $7,550 per year for each plan. Beware, switching plans from one to another starts a brand new maximum out-of-pocket. For you insurance agents, if you'd like access to our free exclusive Medicare Advantage direct mail leads and our advanced training platform, just email me at doug@ufesonline.com. Remember, when you put the needs of your clients first, everything else will usually fall right into place. Now, get out there and do something good for somebody else today. Happy hunting.